a creeping ache in your side, the color draining from your skin, and the relentless fatigue could all be whispers of your liver silently shutting down. The liver is an essential organ that plays a vital role in maintaining the body's overall health. It is responsible for detoxifying harmful substances, producing bile for digestion, and regulating various metabolic processes. When the liver begins to fail, it can lead to severe and life-threatening consequences. Recognizing the signs that your liver is dying is crucial for seeking timely medical intervention. In this video, let's explore the various signs and symptoms of liver failure, the underlying causes, diagnostic methods, and potential treatments, providing a thorough understanding of this critical health issue. Understanding liver function and failure. The liver performs numerous functions that are vital for survival. It processes nutrients absorbed from the digestive tract, detoxifies harmful substances, stores energy, and produces proteins necessary for blood clotting. Liver failure can be acute or chronic. Acute liver failure occurs suddenly, often within days or weeks, and is usually due to toxic injury or a severe infection. Chronic liver failure, or end-stage liver disease, develops gradually over months or years due to prolonged liver damage from conditions such as hepatitis, alcohol abuse, or fatty liver disease. Signs and symptoms of liver failure. Jaundice. One of the most prominent signs of liver failure is jaundice, characterized by the yellowing of the skin and the whites of the eyes. This occurs due to the buildup of bilirubin, a yellow pigment formed by the breakdown of red blood cells. Normally, the liver processes and excretes bilirubin, but in liver failure, this process is disrupted, leading to its accumulation in the blood. Jaundice is often accompanied by dark urine and pale stools, further indicating liver dysfunction. Chronic fatigue and weakness. The liver's role in metabolizing nutrients and providing energy is crucial for overall vitality. When the liver begins to fail, individuals often experience chronic fatigue and weakness. This persistent feeling of tiredness can be debilitating and is not relieved by rest or sleep. The body's inability to effectively process and store nutrients due to liver failure results in a constant state of energy deficiency. Abdominal pain and swelling. Pain in the upper right quadrant of the abdomen, where the liver is located, is a common symptom of liver failure. This pain can range from a dull ache to sharp and severe discomfort. Swelling of the abdomen, known as ascites, occurs due to fluid accumulation caused by the liver's impaired ability to produce albumin, a protein that helps maintain fluid balance in the bloodstream. Ascites can lead to a distended abdomen, discomfort, and difficulty breathing, nausea, and vomiting. Nausea and vomiting are frequent symptoms of liver failure, resulting from the buildup of toxins that the liver can no longer filter out. These gastrointestinal symptoms are often accompanied by a loss of appetite and subsequent weight loss. The body's inability to properly process and digest food exacerbates these issues, making it difficult for individuals to maintain adequate nutrition. Bruising and bleeding easily. The liver produces clotting factors essential for blood coagulation. When the liver is failing, the production of these proteins is significantly reduced, leading to an increased tendency to bruise and bleed easily. Minor injuries can result in large bruises, and even small cuts may bleed profusely. This symptom indicates severe liver impairment and the need for immediate medical intervention. Mental confusion and cognitive decline. Hepatic encephalopathy is a condition characterized by mental confusion, memory loss, and cognitive decline due to the liver's inability to remove toxins from the blood. These toxins affect brain function, leading to symptoms ranging from mild confusion and forgetfulness to severe disorientation and coma. Early signs include difficulty concentrating, mood changes, and personality shifts. As the condition progresses, more severe symptoms can develop, highlighting the need for prompt medical treatment. Dark urine and pale stools. Changes in urine and stool color are indicative of liver failure. Dark urine is caused by excessive bilirubin being excreted through the kidneys, while pale or clay-colored stools result from the lack of bile production. Bile is essential for the digestion and absorption of fats, and its absence leads to noticeable changes in stool color. Monitoring these signs can provide early clues to liver dysfunction. Swelling in the legs and ankles. Edema, or swelling in the legs and ankles, is a common sign of liver failure. It occurs when the liver can no longer produce enough albumin, leading to fluid leakage into surrounding tissues. This swelling, along with ascites, indicates advanced liver disease and necessitates medical evaluation and intervention. Itchy skin. Persistent itching, or pruritus, can be a sign of liver failure. Itching occurs due to the buildup of bile salts in the skin when the liver fails to process bile effectively. This symptom can be extremely uncomfortable and may not respond to typical over-the-counter treatments. Addressing the underlying liver issue is essential to alleviate this condition. Spider angiomas. Spider angiomas are small, spider-like blood vessels that appear on the skin. They are caused by increased estrogen levels in the body due to liver dysfunction. These angiomas are typically found on the face, neck, upper chest, and arms. Their presence can be an indication of liver disease and should be evaluated by a healthcare professional. Gynecomastia. Gynecomastia, or the enlargement of breast tissue in men, can occur due to hormonal imbalances associated with liver failure. The liver's role in regulating hormones is compromised, leading to increased estrogen levels and the development of breast tissue. This condition can be distressing and often requires medical intervention to address the underlying liver issue. Bad breath and unpleasant body odor. Fetor hepaticus, or breath of the dead, is a distinct, musty odor that emanates from the breath of individuals with severe liver failure. It is caused by the buildup of volatile compounds in the blood that the liver can no longer filter out. Additionally, a general unpleasant body odor can result from the accumulation of toxins. These symptoms are indicative of advanced liver disease and require urgent medical attention. Loss of muscle mass. Cachexia, or severe loss of muscle mass, is a symptom of chronic liver failure. The liver's role in protein metabolism is compromised, leading to muscle wasting and weakness. This condition is often seen in individuals with advanced liver disease and is associated with a poor prognosis. Nutritional support and medical treatment are necessary to manage cachexia. Hormonal imbalances. The liver plays a crucial role in hormone regulation. When it fails, various hormonal imbalances can occur, affecting metabolism, growth, and reproductive functions. Symptoms may include irregular menstrual cycles in women, erectile dysfunction in men, and changes in libido. Addressing these imbalances requires a comprehensive approach to managing liver failure. Blood in stool or vomit. Gastrointestinal bleeding resulting in blood in the stool or vomit is a serious sign of liver failure. This occurs due to increased pressure in the portal vein, leading to the formation of varices in the esophagus or stomach, which can rupture and bleed. This condition is life-threatening and requires immediate medical intervention to control the bleeding and address the underlying liver disease. Causes of liver failure. Liver failure can result from a variety of underlying conditions and factors. Some of the most common causes include chronic alcohol abuse. Prolonged excessive alcohol consumption can lead to alcoholic liver disease, including fatty liver, hepatitis, and cirrhosis. Viral hepatitis. Hepatitis B and C are viral infections that can cause chronic liver inflammation and damage, leading to liver failure over time. Non-alcoholic fatty liver disease. This condition is associated with obesity, diabetes, and metabolic syndrome, and can progress to non-alcoholic steatohepatitis and cirrhosis. autoimmune liver diseases. Conditions such as autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis cause the immune system to attack liver cells, leading to inflammation and damage. Genetic disorders. Conditions like Wilson's disease, hemochromatosis, and alpha-1 antitrypsin deficiency can cause liver damage due to abnormal accumulation of substances within the liver. Drug-induced liver injury. Certain medications and toxins, including acetaminophen overdose and some herbal supplements, can cause acute liver failure. Cancers. Primary liver cancer, hepatocellular carcinoma, and metastatic cancers can lead to liver failure as they disrupt normal liver function. Diagnostic methods. Diagnosing liver failure involves a combination of clinical evaluation, laboratory tests, and imaging studies. Key diagnostic methods include physical examination. A thorough physical examination can reveal signs of liver disease, such as jaundice, ascites, and spider angiomas. It's blood tests. Liver function tests measure levels of liver enzymes, ALT, AST, bilirubin, and proteins, albumin, to assess liver health. Elevated liver enzymes and bilirubin levels indicate liver damage. Imaging studies, ultrasound, computed tomography scans, and MRI can provide detailed images of the liver, revealing structural abnormalities, tumors, and the extent of liver damage. Liver biopsy. A liver biopsy involves taking a small sample of liver tissue for microscopic examination. It helps determine the extent of liver damage and the underlying cause. Endoscopy. Endoscopic procedures can visualize the esophagus and stomach to identify varices and sources of gastrointestinal bleeding. Treatment options. Treatment for liver failure depends on the underlying cause and the severity of the condition. Options include lifestyle changes. For conditions like NAFLD and alcoholic liver disease, lifestyle modifications such as weight loss, a healthy diet, and abstaining from alcohol can significantly improve liver health. Medications. Antiviral drugs for hepatitis, immunosuppressive medications for autoimmune liver diseases, and chelation therapy for genetic disorders can help manage the underlying cause of liver failure. Endoscopic procedures. Endoscopic banding or sclerotherapy can control bleeding varices in the gastrointestinal tract. Liver transplantation. In cases of end-stage liver disease or acute liver failure, a liver transplant may be the only viable treatment option. This involves replacing the damaged liver with a healthy donor liver. Supportive care. Managing symptoms and complications of liver failure, such as ascites, encephalopathy, and infections, through medications and lifestyle adjustments. Conclusion. Liver failure is a severe and life-threatening condition that manifests through various signs and symptoms, including jaundice, chronic fatigue, abdominal pain, nausea, bruising, and mental confusion. Understanding these signs is crucial for early detection and timely medical intervention. The underlying causes of liver failure are diverse, ranging from chronic alcohol abuse and viral hepatitis to genetic disorders and drug-induced liver injury. Diagnostic methods such as blood tests, imaging studies, and liver biopsies are essential for assessing liver health and determining the appropriate treatment. Effective management of liver failure requires a comprehensive approach, including lifestyle changes, medications, endoscopic procedures, and potentially liver transplantation. Recognizing and addressing the signs of liver failure can significantly improve outcomes and enhance the quality of life for affected individuals. For more contents like this, click here to subscribe.